This document presents a case report detailing the successful computed tomography-guided drainage of a brain abscess in a young American bulldog. The article, titled Computed Tomography-Guided Drainage of a Canine Intracerebral Abscess, is authored by Kathleen Seddon and Georgina Stewart and published in Veterinary Radiology and Ultrasound in 2025. The report describes a novel, minimally invasive approach to treating a condition that is uncommon in small animal medicine and can have variable outcomes. The study highlights the successful treatment of a 7-week-old American bulldog who presented with a head injury, seizures, and neurological deficits. The introduction of the case report emphasizes the rarity of central nervous system abscesses in small animals, contrasting it with their common occurrence in newborn farm animals. The report identifies several potential causes for brain abscesses, including foreign bodies, extension from otitis, periodontal disease, immunosuppression, skull trauma, or spread of infection through the blood. The clinical signs of brain abscesses are described as varied, often acute, progressive, and presenting with multifocal or diffuse neurological symptoms, though extraneural signs like fever or increased white blood cell count may be present. The challenge in diagnosing brain abscesses is discussed, noting that while magnetic resonance imaging or computed tomography can be used for tentative diagnosis, they can be mistaken for other conditions such as tumors, granulomas, or infarcts. Definitive diagnosis relies on identifying the causative agent through cytology, bacterial cultures, or cerebrospinal fluid analysis. The importance of prompt treatment for brain abscesses is stressed, with the report noting that the optimal approach of medical versus surgical management is still debated in veterinary medicine. The introduction also points out that in human medicine, the combination of computed tomography-guided aspiration and organism isolation significantly reduced mortality rates associated with cerebral abscesses. In veterinary literature, prior to this case, computed tomography-guided drainage of a cerebral abscess had only been described once, in a cat, with success. This case report represents the first documented successful instance of this procedure in a dog. The goal of this procedure in this case was to reduce the size of the abscess, reduce intracranial pressure, and allow for targeted antimicrobial therapy. The report then details the case study, beginning with the signalment, history, and clinical findings. A 7-week-old female American bulldog, weighing 3.14 kilograms, was found by the side of the road with a fluctuating swelling and puncture wounds over her dorsal frontal skull. The wounds were cleaned and the dog was given pain and antibiotic medication. The following day, the dog experienced 3 seizures and exhibited behavior changes. A second examination revealed disorientation, vocalization, and severe obtundation, though blood work was normal. Radiographs of the skull showed an open fontanelle, but no clear fracture. The dog was then referred to a specialist neurologist. The neurological exam showed that the dog was quiet and responsive with periods of obtundation. She was non-ambulatory and fell to the left, with an absent right palpebral reflex, a delayed vestibulo-ocular reflex, and an absent menace response. Additionally, the dog had swelling and purulent discharge on her skull and tenderness upon palpation of the skull. Following the initial presentation and examination, the patient underwent several diagnostic and treatment procedures. Blood gas analysis was normal, but the packed cell volume and total solids were slightly below normal ranges. The dog was then given intravenous fluids and medications to manage pain and inflammation and prevent further seizures. Subsequently, a skull computed tomography was performed under general anesthesia. The computed tomography scan showed a fragmented, depressed fracture of the right frontal bone, and multiple depressed fragments within the calvarium. The images also revealed a mass in the right frontal lobe, with a fluid-filled center, which was consistent with an abscess. The abscess was 2 centimeters in diameter with a thick wall, causing a significant midline shift, cerebral edema, and compression of the right lateral ventricle. Furthermore, there was a subcutaneous fluid pocket above the fracture location. Initial treatment consisted of continuing the intravenous medications, but adding additional antibiotics due to the concern for an abscess. The option of surgical drainage was discussed, but the initial approach was conservative. After 72 hours, the dog's condition worsened, with increased obtundation and anorexia. A second computed tomography showed an increase in the size of the abscess to 2.3 centimeters, and increased cerebral edema, displacement of the longitudinal fissure and compression of the right lateral ventricle. At this point, a minimally invasive abscess drainage was recommended. The report goes on to describe the computed tomography-guided drainage. The area was aseptically prepared and a midline skin incision was made to reveal the fracture. A pocket of subcutaneous abscessation was encountered and evacuated, which had no connection to the deeper structures. The fractured skull was identified and a retractor was used to improve visualization. A spinal needle was inserted into the fracture site and advanced toward the abscess with repeated computed tomography scans guiding the process. Purulent material was allowed to drain from the abscess. Following the drainage, a final scan was performed, which confirmed a reduction in the size of the abscess. A sample was collected for culture, and the subcutaneous site was lavaged with sterile saline. A closed suction drain was placed at the site. The surgical site was closed and the patient was given medications to reduce cerebral edema. The active suction drain produced minimal fluid, and it was removed after 2 days. The patient's mentation improved during the hospitalization, and she was able to walk unassisted 4 days after the drainage procedure. Figure 1 shows dorsoventral and right lateral calvario radiographs of the 7-week-old American Bulldog upon presentation. Figure 2 includes transverse, sagittal, and dorsal planes of computed tomography images that showed a fragmented depressed fracture of the right frontal bone, with a fluid-filled abscess, and then images following 72 hours of medical management showing progression of the abscess. It also shows a 3D reconstruction of the fractured bone. Figure 3 shows computed tomography images of the spinal needle adjustments during the drainage procedure, an in situ image of the dog during the procedure, as well as computed tomography images confirming spinal needle placement within the abscess. Table 1 summarizes other cases of canine intracerebral abscesses reported in the veterinary literature. The table includes information on the signalment, location of the abscess, cause, management, and survival outcome of each case. The table indicates that causes included hematogenous spread, immunosuppression, otogenic extension, foreign bodies, trauma, and periodontitis. The table shows that prior to this case, management ranged from medical management to surgical intervention. The bacterial culture isolated small, alpha-hemolytic, gram-positive cocci, which could not be identified further. Based on sensitivity results, the antibiotic was changed to doxycycline, and the patient was discharged with 8 weeks of antibiotics and an anticonvulsant, and a pain medication. Follow-up appointments at 1 and 7 weeks indicated normal physical and neurological exams, and the anticonvulsant was discontinued after 6 months. 20 months following the procedure, the dog remained clinically well. The discussion section of the report emphasizes that this is the first report of computed tomography-guided drainage of a brain abscess in a dog, and the second report of such a procedure in veterinary medicine following a report of a successful drainage in a cat. The report notes that unlike previous cases of brain abscesses, the dog had a successful outcome with no further seizures. The report discusses that while magnetic resonance imaging is typically considered the primary diagnostic tool for brain disease, computed tomography was used in this case for several reasons, including a shorter procedure time in an unstable pediatric patient, lower costs, greater availability, and superior visualization of bone. The report indicates that computed tomography was sufficient to identify features of the abscess and provide information about the skull fracture. The key benefit of using computed tomography was its ability to facilitate image-guided aspiration of the abscess in a way that would be extremely challenging to perform blindly, and also would not be possible with magnetic resonance imaging because of the metal artifacts and time needed for image acquisition. Open surgery, while an alternative, is more invasive, expensive, and requires a longer recovery time. The authors suspect the patient sustained a bite wound based on the fracture morphology and associated infection. The report mentions that while bacterial central nervous system abscesses are often polymicrobial, with aerobic bacteria being more common than anaerobic bacteria, the culture results could not confirm the species. The report does note the gram-positive alpha-hemolytic cocci is most consistent with a streptococcal or staphylococcal infection. The clinical presentation of the patient is noted to be consistent with a multifocal neuroanatomic localization including symptoms indicative of a prosencephalic lesion and a brainstem lesion. The brainstem signs were considered secondary to increased intracranial pressure, and mass effect of the abscess. The patient's young age is also discussed as a potential factor in the successful outcome, noting that neuroplasticity is higher in younger animals, allowing for the brain to better recover following trauma. Additionally, the authors note that a dog's brain is not fully mature until approximately 16 weeks of age, meaning that the young brain might have better managed this type of injury. The report also references a study of traumatic skull fractures, and notes that while skull fractures can often result in neurological deficits, they do not have a negative prognostic factor. The choice to leave the fracture fragments in situ was due to the desire to avoid a more invasive surgery, and that the patient's neuroplasticity was likely to allow her to manage with the fragments in place. The report mentions the risk of post-traumatic epilepsy following a brain injury, noting that the risk of developing epilepsy is proportional to the severity of the injury. The pathogenesis of this is suspected to be due to inflammation resulting in hippocampal excitability. The report discusses immediate, early, and late post-traumatic seizures, and that the risk of late seizures is increased if there were immediate or early seizures. In this case, the patient was treated with an anti-epileptic drug for 6 months and then it was discontinued because there were no further seizures. The owners were cautioned about the risk of future seizures. The report concludes by highlighting that computed tomography-guided drainage of intracerebral abscesses is a successful treatment modality that is less invasive, allows for targeted medical treatment and direct sampling, and improves clinical signs rapidly. The article includes a list of author contributions, a conflict of interest statement, funding information, a data availability statement, and a disclosure that this material was previously unpublished. It also notes that this report is part of the requirement for a neurology and neurosurgery residency program, and ethics approval was not specifically required for publication. The report includes a list of references. From Vet NeuroJar, Keep Those Minds Inspired, Hearts Light, and Tails Wagging,